Now come to the next part, that is the loop of Henle. This is the thick ascending limb of loop of Henle. Let's talk about this. In the thick ascending limb of loop of Henle, there is a transporter that transports sodium inwards, potassium inwards, and two chlorides inwards. It takes all these ions inside the cells of thick ascending limb of loop of Henle. Now let's say this is a cell in which these ions are taken, and as we have to know that here are the transporters on these cells. What these transporters are? These transporters are again sodium potassium ATPase pumps that takes 3 sodiums out and the 2 potassiums inwards, taking the 3 sodium out and 2 potassium inwards. As we are seeing here, the potassium is increasing inside the cell, and here chloride can freely move from there to there. As the potassium is increasing inside the cell, here are the transporters. Here are the transporters, numerous transporters that put potassium out. Here the potassium is putting out. Okay. As we know, here the ions are coming, and positive as well as negative ions are coming. As here the potassium is coming out, and here also the positive ion coming, so there is some repulsion. So some of the potassium ions will spill out from here. If we see, what are they? They are the magnesium or they are the calciums that are spilled come here. Okay, this limb is permeable for solutes but not for water, so solutes are coming here out. Solutes are coming out. Okay, now see, we want to know, this is we have discussed the carbonic anhydrase inhibitor in the previous video. These were the first group we have discussed. Now we will discuss the second group of drugs, that are the loop diuretics. Second, that is the loop diuretics. What loop diuretics do? Loop diuretics will inhibit this sodium, potassium and 2 chloride co-transporter. So these are transporting to the same direction. It is called co-transporter. So loop diuretics will inhibit sodium, potassium and 2 chloride co-transporter, and this transport will be inhibited. If this transport is inhibited, sodium will excrete in the urine, potassium will excrete in the urine, and chloride will excrete in the urine. So this group of drugs will cause diuresis. Let's come to the example of this group of drugs. I will write here furosemide. Furosemide is one of the most common example of this group of drug. Next example will come torsemide, furosemide, torsemide, and the next example. What is the next example? Bumetanide. So furosemide, torsemide and bumetanide are the examples of loop diuretics that will inhibit sodium, potassium and 2 chloride co-transporter in the ascending limb of loop of Henle. It will increase the excretion of sodium and chloride in the urine. The tubular fluid that will reach from thick ascending limb of loop of Henle to DCT will be rich in sodium and chlorine and potassium. So it will be excreted and the diuretic effect will be seen. One important thing here we come to know, that loop diuretic also have the weak carbonic anhydrase inhibitor effect. So the weak carbonic anhydrase effect is also seen in the loop diuretics. And one more important thing we want to know, in the PCT, the sodium absorption. In PCT, sodium absorption is 75%, and in the thick loop of Henle, in the thick ascending limb of loop of Henle, the absorption of sodium is 25%. Okay, this one more important point we come to know. Now loop diuretics will increase the excretion of calcium and magnesium also. How? Because as this is blocked, so potassium, these positive ions will not go in, these potassium goes no go in, and they are not forced to come here, and the absorption of these ions will also decrease. So the loop diuretic also excretes calcium, and this is the not seen in the other diuretics. This effect is seen in on this. We can learn like this loop loses the calcium and all others not loses the calcium. Okay, this is about the loop diuretics. Now one important point that we have to learn here is, as it is showing weak carbonic anhydrase effect in the PCT, sodium and bicarbonate absorption is also affected, but it is weakly, and this effect is done with the help of prostaglandins. Okay, this is the point we have to learn. As potassium is losing, so it will cause hypokalemia, and sodium and positive ions are losing, it will cause alkalosis. And what is the use? Now come to the use. Use of loop diuretics. Loop diuretic is used in the quick relief of left ventricular failure. Next, pulmonary edema. If there is pulmonary edema, this is used. Furosemide is the strongest loop diuretic. Loop diuretic loses the water and sodium to the very great amount. So in edema, this is helpful. Okay. GFR is not altered. By these loop diuretics. So loop diuretics can also be used in renal failure. Okay. Most potent. Now come to know about the most potent, bumetanide. Bumetanide is the most potent loop diuretic. And if we ask about the longest acting, torsemide is the longest acting loop diuretic. Okay, this is what we learn about loop diuretics.